everyone. My name is Dr. Tanya Defferary, and I am a counseling psychologist in Port Elizabeth, South Africa. And it is my absolute pleasure to introduce our guest speaker who's joining us on our Expressive Parts workshop in South Africa that's happening in April this year, Dr. Ntombizanele Menze. Did I say that right?
Absolutely, absolutely.
So, Dr. Menze is a medical doctor with a special interest in mental health and also a certified traditional healer. And so I think it just brings such a truly holistic perspective, integrating the wisdom of both Western and traditional healing approaches. And I think it's just so important in our country. Her work just beautifully honors the interconnectedness of the biological, psychological, social, and spiritual dimensions for well-being. Um, and so, with gratitude and open hearts, let us welcome Dr. Menze, and I'm going to try and say this. Emakosini Ndawe Tokozani Kamagwini. And this means the divine in us embraces and celebrates the divine in you. Welcome, Dr. Menze.
Thokozani. Thank you so much, Tanya, for inviting me for this absolutely special workshop that we're about to have. I really, really am honored to join you guys.
And I think we're so excited to have you bringing this, just what it just feels like a missing piece to the puzzle, if I can say it like that, in how we look at mental health and, as you said, disease in our country and in people. And could you explain a little bit how you sort of, I don't know what the right word is, combine or see both the sort of medical doctor and the traditional healer operating in the work that you do?
Absolutely. So, as most healers would say, that we are actually spiritual beings having a human experience, right? So, this human experience is that comprises of a body, a mind, a soul, and a spirit, right? So, when I look at people, when I look at each and every person that comes through for help, whether it's a client, it's a friend, it's a patient, whichever way I see it, I always think about it this way, that we are biological beings, meaning that we've got this body, and this body is containing of organs, it's got chemicals, etc. And also this body is part of a lineage of or a generation, right? So that is where in the Western eye we talk about genetics, right? And then we also look at the psychological aspect of things as well, where that we are part of our childhood. Our childhood brings a lot of narrative in terms of how we perceive certain things in life as adults, right? So we psychological beings. We know about childhood trauma that can be looked differently when you look at it with a Western perspective versus the spiritual perspective as well. And then we also social beings, meaning that we're part of an environment, we're part of a society, and we can never detach ourselves from an environment and the society. And the Western eye will talk about epigenetics, where your genetics and your interact with your environment, right? And we are also part of a spirit, the spirit, meaning, as I've said earlier, that we are currently having a human experience, but we are actually spiritual beings having a human experience. And any illnesses of the spirit, or that our patients articulated that they come from the spirit or culture, we can never detach that from us. So that is how we actually approach and look at things from my perspective, which is actually has absolutely been such an interesting journey. Yeah.
And I mean, I think what it feels like in it, it adds like an extra layer. It's adding,
Absolutely.
So it's not in a sense taking away from, but adding a different perspective, a different way of looking at the concerns or problems or things that your clients or patients are dealing with.
Absolutely. And the other thing that we also need to understand, that South Africa is a diverse society. I don't only want to say South Africa, let's say worldwide. We're quite diverse, coming from different backgrounds, right? And the way we articulate our dis-ease, because we don't like to use the word diseases, the way we articulate our dis-ease could also be cultural. And we need to embrace our patients, and we need to celebrate them, for bringing that part into the picture and, navigate around that as well. So, for instance, somebody might say, my depression is actually, I believe I'm having a calling, for instance. me as a Western doctor, I cannot say, no, we don't talk about that. We don't want to talk about that. I don't know what that is. I need to embrace that component. So most Western doctors would say, I'm not qualified to actually speak about this, but now we are approaching in an era where I don't qualify to speak about it, but I can maybe try and refer you to somebody who's more qualified to speaking about that component of your illness, for instance, which is absolutely beautiful. We're not saying that these things do not exist, spirit doesn't exist. We know fully that there's spiritual component and diseases that come around as well that we also need to take into considerations when we look at our patients. Same as, when I speak to healers, I always tell them that yes, the person is having a calling, for instance, but we cannot shy away that the calling has brought about a physical illness that we need to now also manage accordingly as well, while you're navigating around the spiritual aspect of things, for instance.
Yeah. And I think in listening to you, it feels like it's really meeting the client where they're at. And it's rather than a denying, but an embracing of the whole person and beyond, actually. And really speaks to a lot of the work that I do in contextual therapy as well, with looking at intergenerational legacies and all of that. And I think, as you mentioned, it's so important, not just in South Africa. We come from, in the world, such diverse cultures, and it's starting to, as healers, to be able to meet people where they're at.
Absolutely. And when you speak about the intergenerational, also how we look at things is we look at the background of the patient. So Western would look at the family history, but as healers, we're more interested in the lineal patterns of the family. So somebody might say, I'm depressed, but one healer might pick up, oh my goodness, there's actually a granny that passed on, and this granny never healed from whatever it is that was there. And this granny is actually articulating that disease in this particular person. So we need to actually not only heal the physical, but we also need to heal the granny so that the granny can heal from the past trauma as well, so that the whole generation, and that's what we talk about, breaking generational curses. So we look at the grandma and pick it up like that. Sometimes you look at a patient and the family and you notice they're here for depression and maybe PTSD, but you dig deep and you pick up, oh my goodness, there's so much trauma in this family. There's been so many accidents in this family. People are dying from accidents. What we as healers do, why? What's happening with the trauma in this family? Where does it come from? And believe me, Tanya, sometimes we can pick up, oh my word, there's a grandfather that died from, let's say, a train accident decades ago. And that grandpa spirit was never collected, for instance, and never appeased and never rested. So that is why the pattern is continuing in this family. So once that grandfather is healed, cleansed, and then everybody else in the family will notice that that trauma actually stops in that particular family. So that is how deep we look at things. We go back into the generation, see why is, for instance, another example, why are the ladies in this family are not getting pregnant? What's happening? Then we look at the pattern of the family. Yes, Western wise, we might look at the pathology, we might look at the uterus, and we might look at the hormones. But sometimes spiritually, especially when doctors have picked up, no, man, we don't find a cause here. So we look back and we trace, oh my word, there's ladies in this family that never got pregnant, that never healed. So we need to first heal them before, we break this generational curse, for instance. For many, this family, they're prone to addiction, for instance. What's happening here? Who needs some healing in this family? But not in the physical realm, but in the spiritual realm. So we look back and say, oh my goodness, there's some healing that needs to take place here. And as I've explained earlier, I think you've heard when I was speaking about psychology, and us as healers look at psychology quite differently as well. So remember, childhood trauma is so important, but we as healers are looking at childhood related rituals and customs and values, right? That never happened, or they were done, but done incorrectly. I'm going to just make you an example. There's rituals called imbeleko, for instance, where a child, when they're young, they need to officially be introduced to the ancestors. So those days where our forefathers and our foremothers were still alive, usually when the mommy's at the hospital or even giving birth at home, after the giving birth process, there's already a goat outside waiting for that ceremony to take place. But people have freestyled that ceremony or that custom for years, and they've sort of detached from that. But sometimes us as healer, we pick up, oh my word, this child's mbeleko or the formal introduction to their guides was never done. Or the parents were never married, for instance, right? And if the parents were never married, that ritual is supposed to take place to the maternal side of the family. But it was done now at the paternal side of the family, meaning what we look at now, it's root-related spiritual errors or deaths.
Wow.
So that is where we see, and then you'll see these kids growing up, things are going okay, but sometimes things are not going well as adults. And then you look back, you're like, oh my word, there's a root-related spiritual error that was done, and that needs appeasing and apology so that the guides can just sort of, realign this child. Remember, each and every custom and ritual is not just for fun. It's usually when you reach the next level of growth spiritually. Yeah, so that is why it's so important who does it, when is it done, and how is it done. So that is so important, because it's going to lead to elder-related chaos. No direction. You start one thing, you don't finish it. You don't have a career, you're not focused, etc. Almost like a tree that is not planted well, so it won't bear the necessary fruit that it's supposed to bear, for instance. So that is how we look at things intergenerational, which is absolutely beautiful.
Sure, I can see your passion. It just shines out of you. And Dr. Menze, I cannot wait to just actually experience you at our workshops and just learn more from you. I'm really looking forward to it. Thank you so much.
Absolutely, it's so beautiful. Thank you so much. And often